The nurses held a 24-hour walkout last week at 14 Twin Cities hospitals. Union leaders call the hospital's request for a no strike, no lockout agreement a delay tactic. Joining me now to talk about where the nurses stand in all this is RN Nellie Munn, who is also one of the negotiators for children's hospitals and for the nurses at children's hospitals. Nellie, thank you so much for being here.
Thanks for having me.
Let me ask you, what would you like to tell the public about this vote tomorrow, especially in light of the hospitals basically continue to maintain that the nurses are asking for things that no other worker in any workplace gets in terms of their compensation, in terms of their benefits?
Well, the fact is that the hospitals are really going after nurses and trying to remove agreements that we've negotiated many years ago and really trying to damage the terms and conditions of employment for nurses. Now, at the same time, nurses are asking for improved staffing and patient care because that's really our #1 priority as nurses. And so there's really kind of a clash of values here. And what's been happening is the hospitals put in a lot of messages about what we're asking for, really mischaracterizing the campaign of what nurses are asking for, and really just not telling the whole truth of what's really happening at the bargaining table. And the fact is that we came on day one with a number of proposals that would really improve patient care, improve the hospital's ability to respond to public health disasters with staffing and so forth, protecting nurses from infectious disease, things like that. And the hospitals have ignored all of those proposals and instead have focused on a whole host of concessions that they want to remove from the nurses' contracts.
All right. I know that the nurses keep talking about staffing, but there are a number of monetary proposals in your proposal that are quite significant. You're asking for 4% raises every year for the next 3 years. And another thing, in terms of the health insurance proposal, you're asking for the hospitals to up the amount that they are contributing to your health plan, 95% of the cost. Those kinds of increases are increases that nobody's getting in this kind of an economy.
Well, the fact is that our wage proposal is at 3.5% per year, and we have to have a wage proposal on the table in order to bargain something. We knew a year ago that the hospitals actually wanted to bring our wages to 2008 levels, even though they're continuing to be quite profitable, making over $700 million in profit in 2009. So we simply had to come with something if there's going to be any room to bargain. And the fact is that they're sort of focusing on that, but that has not been the focus of our campaign. As far as the health care coverage, we have some evidence that some of these self-insured plans that the hospitals provide to nurses are actually, in fact, turning profits themselves. And so what we're asking for is just simply that the hospital provide the coverage and not charge nurses money that's actually just going into their coffers as a profit.
All right. I know I've been getting a lot of emails and also been looking at your Facebook page, the Nurses Union Facebook page, and obviously there's a lot of anxiety for people voting on a strike, having to go without a paycheck for an open-ended period of time. What is your prediction on how this vote will go? Because it's very different to vote on an open-ended strike than just the one-day strike that you approved a few weeks ago.
Well, we've asked nurses to authorize up to and including an open-ended strike, and really what we're asking them to do is to authorize each bargaining team within every facility to be able to issue a strike notice if it's needed. Because what's happened since March when we began bargaining, these hospitals have not responded to our proposals. They have taken a very hard line and really have not acted in good faith. And so we really have exhausted every avenue in trying to attempt to bargain. We've set out dates that were available. We've really tried everything possible. And so going into bargaining now, we feel that we need to have the strength of our nurses behind us so that the hospitals are very clear that if we can't come to a reasonable agreement that's fair, that nurses will go on strike. So that's what we're asking for. We're not planning to issue a strike notice right away, only if all attempts fail.
All right. Well, Nellie Munn, thank you so much. Obviously, we'll be following this. The voting starts at 6 a.m. tomorrow.
Thanks
for coming in.